My name is Anton Zitnik. I'm a Senior Occupational Health and Safety Consultant with the Victorian Chamber, and in this video I'd like to talk to you about mental health self-care during the coronavirus crisis. So mental health self-care is not a new topic. It's basically the idea that during times of stress, we need to do things proactively to keep our mental health in good shape. So think about it this way. If you were to undertake something physically strenuous, such as running a marathon or climbing a mountain, you would have a plan in place to maintain your physical health during that stressful period of time. And it's the same idea with mental health. So what I'd like to do is talk through some of the most common recommendations for mental health self-care that you see on mental health support websites such as Beyond Blue, Sane, Black Dog Institute, and sites like that. The first thing I want to talk about is the very strong links between physical and mental health. So a simple but critically important thing you can do during this time is trying to maintain a healthy exercise regime. Exercise is a natural antidepressant. It's commonly recommended as part of treatment plans for anxiety and depression. And even though it's difficult to keep up an exercise regime during stressful times, you'll find you'll get incredible return on investment by keeping up that regular exercise routine. And this can be different things for different people. We're not talking about running marathons here. We're talking about walking, cycling, can be a whole range of activities. Anything that just gives you a little bit more physical activity throughout the course of your day is going to give you double bang for your buck, both in terms of your physical health and your mental health as well. Maintaining a healthy diet is also really important too. So you can get onto any website and read in a very short amount of time about the strong links between what we eat and the way it affects our mental health as well as our physical health as well. So another thing you can do during this time is limit your intake of stimulants such as caffeine and alcohol. Obviously, a lot of people turn to these things during stressful times, but we have plenty of research to demonstrate that these things in the longer term can compound the problem. Another really important thing we should be trying to do during times of stress is to get enough sleep. Again, if you go to any mental health support website, such as Beyond Blue, you can read about the strong links between the amount of sleep we get and its impact on both our physical and mental health. So we're talking about things here such as just trying to get into a sleep routine, trying to avoid taking in stimulants such as alcohol and caffeine before trying to go to sleep. Another common recommendation is not keeping digital devices in your immediate sleeping area, not reading the news directly before you go to bed or things like that. Another thing we need to do to maintain our mental health is to invest strongly in our relationships. And this, of course, in the time of COVID-19 is a very difficult thing to do with so much of the world in lockdown. But at these times, what we need to ask ourselves is, well, what does that look like for me at the moment? Who can I reach out to? Who can I connect with, and in what sort of form? So whether this is finding new ways to reach out to work colleagues, friends, family, using digital devices, we all need to ask ourselves, what are some ways we can connect with other people we care about during these times of crisis? The reason this matters so much is because research tells us that people who don't have strong support networks during a time of crisis are those who are at higher risk of developing poor mental health during those stressful times, whereas people who are supported by friends, family, work colleagues in the community are more likely to be able to get through difficult times if they've got a strong support network around them. So although that's going to look very different in the time of COVID-19 with so many restrictions on meeting people and meeting in groups and things like that, the question we all need to ask ourselves is, well, what does reaching out and being socially connected look like for me during these times? Another really important point is to make sure you have time during your day to do things that you enjoy doing outside of work. And this is easier to say than to do, because if you're running a business at the moment or you're a manager, you're probably in crisis mode and just doing everything you need to do to keep your business running during these challenging times. Nevertheless, we need to think about the things we enjoy doing outside of work as not something we get around to when we have time, but a critically important piece of the jigsaw puzzle in maintaining positive mental health during stressful times. Achieving a state of flow, that is when you're doing things you enjoy so much that you become absorbed in them, you forget about time and place, is incredibly beneficial for our mental health. It's really important as well that the things that we enjoy doing actually challenge us as well. And there's a critical difference here between active and passive leisure activities. Passive leisure activities are all very well and good. We all need to kick back and relax from time to time. But in order to achieve that sense of flow, we need to be doing an activity that challenges us and pushes us a little bit, where there's a good balance going on between the challenge that activity is providing us and our level of skill in responding to the activity. I want to talk now about stress management. So stress management is an important topic at the best of times, and particularly important during these challenging times of COVID-19. Stress is unavoidable in our lives, and it's particularly unavoidable during these times. However, the way we manage stress varies considerably from individual to individual. And the idea of stress management really is just to have some self-awareness about the things that make you stressed and have at hand some healthy, effective responses that you know work for you, as opposed to resorting to unhealthy short-term solutions such as the ones we talked about earlier on. Mindfulness is also an important topic as well, and there's plenty of websites you can go to that talk about what mindfulness means and how to practice it during the time of COVID-19. So taking some time out just to be aware of your own state of mind, acknowledging the difficult times that we're in, acknowledging the anxiety that it causes all of us, is a really good use of your time. Another common recommendation during this time is to be very intentional and deliberate about your media diet as well. So during this time, all of us are naturally taking in a lot of information about COVID-19, and that's important to do. We need to know what the current rules and restrictions are. We need to understand how we need to change our behavior. But as you can imagine as well, taking in a lot of information about this very distressing topic is also going to have a negative impact on our mental health. Another important recommendation as well is to make sure that you are taking in reliable sources of information as well. And this is something, if you're a manager or an owner of a business, you should also encourage amongst your staff as well. There's a lot of information flying around about COVID-19, and it's really important that you get your information from reputable, reliable sources and encourage others to do the same. Another important thing to think about is to recognize the early warning signs of poor mental health in yourself and also in others as well. So if you're managing people, noticing those early warning signs in your employees of sudden changes in behavior, reduced work performance, changes in a person's appearance, they're all signs that someone you're working with could be struggling with poor mental health. And these things can be simple enough to recognize in other people, but actually quite difficult to recognize in ourselves. So if people around you that you trust are telling you that your behavior has changed or your physical appearance has changed or they're concerned in some way about your mental health, don't brush that off and be prepared to seek help early. One of the most common recommendations with mental health is that if you do recognize those early warning signs, to get help early. So again here, there's some interesting parallels between physical health and mental health. For example, if you were experiencing pain in your liver and you decided just to ignore it and hope it would get better, it's not going to. And in the end, the treatment you will need and your recovery will be longer, more expensive, more painful than if you had acted early. And the same is true of mental health as well. If you recognize those early warning signs, either in yourself or others, getting onto it early and seeking help early is the best thing you can do to give yourself a better chance of recovery. So if you are experiencing the early warning signs of poor mental health, I would strongly encourage you to reach out to your treating medical practitioner or else any one of the number of excellent mental health support services that we have in Australia, such as Beyond Blue, Lifeline, organisations like that. Thanks a lot for listening.